Hello, I'm Dr. Kathleen Martin, Conference Chair of Vascular Discovery, and I'm excited to be speaking with our keynote speaker, Dr. Stanley Hazen from the Cleveland Clinic. He shared with us some extremely exciting cardiovascular science this morning, and I'm so glad for this chance to chat with you about it and share it with a larger audience. So I was so thrilled to have you on the program because of your groundbreaking new work on the cardiovascular health implications of artificial sweeteners. I know a lot of people use these type of sweeteners thinking that they're healthier, but your work suggests that they really are not. And I'd love if you could summarize some of your most important findings for us.
Well, first, thank you for having me. What we did is looked for chemical signatures in the blood that predicted the future development of heart attack, stroke, and death in patients. And these were subjects actually who were followed for many years. And so we were interrogating the samples at the time of collection when they may or may not have had heart disease and looking for what predicted future risk. One of the surprising findings was that many of the metabolites that were linked to future risk of heart attack, stroke, and death are what we call polyols. These are found in intermediary metabolism, but they actually also more recently are being used as sugar substitutes. So sugar alcohols like erythritol, xylitol are compounds that are used as sugar substitutes because they lack the calories, but still to our taste buds taste sweet. And so large-scale clinical studies showed that levels of erythritol and xylitol predict future development of heart attack, stroke, and death. And then animal model studies show that when you elevate erythritol and xylitol levels to what is seen in subjects, they have enhanced clotting risk. Further mechanistic studies showed that as you raise erythritol and xylitol levels, the platelets become hyper-responsive and more prone to clot. And then probably some of the most surprising and concerning findings were when we took healthy volunteers and had them drink a erythritol sweetened drink versus a glucose sweetened drink and measured in their blood before versus 30 minutes after ingesting this, multiple measures of platelet function. In every single subject, we saw dramatic increases in platelet responsiveness and reactivity to multiple different triggers like EDP, thrombin, and also with multiple different measures of platelet function.
What was really striking to me was you showed how elevated those polyol levels remained in the blood even after a single drink of artificial sweeteners.
So in the case of erythritol, which it's used as a one-to-one replacement for sugar and is a little less sweet than sugar, following consumption of 30 grams, which is a reasonable sized portion for an 8-ounce drink, to sweeten it, like if it's iced tea or lemonade, that amount was sufficient to make the plasma level go up 1,000-fold. And even in healthy volunteers who have normal kidney function, it took days for the plasma level to come back down to baseline levels. So during that interval period for days, their plasma level was high enough that it turned the rheostat on platelets up and made them more prone to clot. And the very people who are most likely to be ingesting artificial sweeteners are processed foods like keto-friendly foods, zero carb, low calorie foods are the ones that are most prone to be at risk for clotting.
That's what I think is so profoundly impactful about your work, is that so many of the patients who have risk factors for cardiovascular disease are relying on these artificial sweeteners, thinking that they're doing something good for their health, and then they're at risk for this platelet hyperactivation and atherothrombotic events like myocardial infarction and stroke. Your work is so important for public health, and I'm glad that we could have you here to help spread the word about this. Thank you so much for joining us here and for sitting down to talk with me about it. We greatly appreciate it.
Well, thank you for having me.